Hi, I'm Dr. Lili, and this is my Pocket Pediatrician. So I want to start this video with a question. So if you can just answer in the comments below, I'd love to hear what you have to say. What is the craziest thing you've ever read on the internet about health? I'd really love to hear it. Have you heard that wearing a bra will give you cancer? Or that eating chocolate will help you lose weight? Did you know that wearing nail polish will make you fat? How about that wearing sunscreen will cause skin cancer? Or that vaccines can cause autism? Each of these claims has been widely reported and often believed by the general public. And while each of these claims were made based on a scientific study, the research behind them may not have been very strong. Why? Well, there were problems with each of these studies that I mentioned. When I was in medical school, one of the things I had to do was learn about all the different types of studies that can be done in research and how each one can be valuable in a different situation and when to use each type of study. Depending on what you want to learn about, there may be a time and a place for each different type of study. So I'm going to teach you a little bit about some of these basic study types and what makes each one of these weaker or stronger. We're also going to talk about how doctors and scientists take these studies and use them to apply the information to your health. Finally, we also need to talk about a few of the elements that are important when considering the validity and whether or not there's bias in the study. So before you go off burning your bras, eating chocolate, and sunbathing without any sunscreen, let's have a quick chat about what makes good research and what doesn't.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.
Even though I only became a doctor 14 years ago, I've seen a big shift in the doctor-patient relationship in that time. And some of my colleagues who've been in medicine even longer have seen a much bigger shift. There have been a lot of different reasons for this. Changes in insurance policies, reimbursements, adjustments, strains on your time, social media, and a lot of other changes. I'm not saying it's good or bad, it's just different than what it used to be. One of the biggest changes is a patient used to come to the doctor and say, I've got this symptom and this symptom, what do you think it is? And now a lot of times what I'm seeing is a patient comes in and says, I've got this symptom and that symptom. I've already done all my research. I want you to get me an MRI and I need these labs ordered today. It's a very different dynamic between the doctor and the patient than it used to be. And when somebody tells me I've done my research, I don't know if that means they've conducted an IRB approved study and actually done research on the issue. It means they made a nice cup of coffee and sat down on Google for a couple hours and researched different articles that may or may not have been valid. I can't tell you how many tearful mothers I've had come into the emergency department in the middle of the night convinced that their child has cancer or a devastating neurological disorder because they've spent a few hours on Google and have managed to convince themselves of the worst. I've talked to a lot of very well-educated parents who are convinced that a vaccine will cause irreparable harm to their child, but that squirting breast milk into their eyes is a great idea. I'd had one mother who had done so many harmful things to her child that it resulted to a visit in the emergency department in the middle of the night. I almost considered discussing it with CPS because she had done so many things that had actually harmed her child. But she seemed so sweet and well-intentioned that I decided to actually Google all the things she had told me she had found on Google. I was shocked to find out there were actually articles supporting each of the things that she had done. Her believing these articles resulted in one of the worst eye infections I'd ever seen, and she had basically ripped almost all the hair off her baby's head, unfortunately. I was able to give her some guidance about what to do in this situation, give her baby the treatment that he needed, and also show her some more reputable sites where she could get good information about her child's health. I don't want to waste today giving you a bunch of the I read it on the internet mishaps that I've seen, but what I do want to do is give you some tools so that you can critically evaluate the articles that you're reading and determine if they're actually good and might apply to your child's health or not. So when a scientist decides they want to do research, they first have to figure out the question they want to answer, and then they have to figure out what type of study is going to be the best to get that answer. I'm not a research scientist, but I have published a few studies, so I've been through this process a couple of times. When you're going to put your time into doing research, you want to make your research powerful. You have to decide what result is going to be clinically significant for it to matter, and then you also have to decide how many people you're going to need to use in the study to make it statistically significant. You also have to make sure there's no bias. If I'm working for a drug company and I have a financial interest in bringing something to market, I should not be one of the investigators on that study. Scientific investigators should be as unbiased as possible. They should have no financial interest in any of the work that they're doing, and no other interest that should introduce bias. So generally, if I want to do an experimental trial, the best kind of gold standard would be a double-blind randomized control trial. What that means is that subjects are randomized into 1 or 2 or 3 different groups. Participants are randomly assigned into groups like placebo versus drug. They don't know what group they're in, and the investigator does not know what group they're in. Only after all the data has been analyzed, the group revealed, and then the results can be published. Randomized control trials don't work for every type of situation. Think about if I was wondering what's worse for a baby, if the mother is pregnant and she's using cocaine, or if she's using alcohol, or neither. I can't just find 99 women and have 33 of them take cocaine in pregnancy, have 33 of them use alcohol, and then have 33 of them do neither. That wouldn't be ethical. So a lot of times what you have to do in a situation like that is do an observational study where you're not intervening in the person's life at all. You're just watching what happens and making conclusions based on the results that you find. These are called observational studies. My children are actually enrolled in a cohort study called the First 1,000 Days of Life. When I was pregnant, they took some blood samples from me, and then the researchers basically are following my children for the first 3 years of their life. Every 3 to 6 months, they send me a survey, I fill it out, answer questions, send it back to them. I can't be sure exactly of what they're studying, but it looks like what they're trying to do is see if any markers in my blood would be able to predict any type of neurobehavioral issues later in life. There are also case control studies where they find people with a certain disease and then they look back in their lives to see if there are any common risk factors. This wasn't a research study, but if you think about Erin Brockovich, the lawyer who found all those children who had cancer, and then she went back and found the commonality behind them to figure out what the cause was, that would kind of be an example of a case control study. Sometimes they do cross-sectional studies, which is basically where you just take a large group of people and look at them for one snapshot in time. A lot of research is done in this way where you just find one difference. So you might be wanting to compare how baby boomers versus Gen Xers versus millennials feel about a certain subject. So they'll send out surveys that ask the same question to all of them, and then they'll kind of divide them up into categories based on their age, or it could be any other type of qualifying characteristic. Typically, these cross-sectional studies need a lot of people in order to get good data because you're just looking at them at one moment in time. So in order for the study to have good power, you have to have a lot of participants involved. You know how sometimes it seems like different studies will ask the same question and get different answers? Every time I make eggs, my husband says, they don't know what they're talking about. Half the time they tell you eggs are good, then they tell you eggs are bad, then they tell you eggs are good again. Part of me kind of thinks that this is because he likes pancakes, but part of me thinks he does have a point there. When different researchers ask the same questions and they get different answers, it can be maddening. You can actually go through each of the studies and figure out which study was more powerful or which study might be more valid, but who really has time for that? Well, if it's a question that a lot of people studied and the answers seem confusing, sometimes what they do is they'll do something called a meta-analysis. A meta-analysis is basically when researchers will take all of the studies that have been done on a certain subject, put them all together, reanalyze the data all into one giant study where they can kind of throw out any of the outliers and the bad data and put it all together to get a more powerful study that might give us a better answer when a lot of people have gotten different answers to the same question. These meta-analyses can be very powerful studies because they basically boil it all down to one big pile of data, and that way you're comparing apples to apples and can get a good answer to your question. A lot of medical recommendations that are in existence right now are a result of meta-analyses that have been done. So unless you want to become an actual research scientist, how do you know which articles to trust? In general, you want to look for information that's been published in a peer-reviewed journal. I'm talking about the New England Journal of Medicine, JAMA, Pediatrics, and The Lancet, just to name a few. There are many reputable medical journals out there that have big committees of people review all the data and the study to determine if it's valid before any of the articles are ever published in their journals. I have stacks of these journals around the house because they come in the mail and I'll see something, think, oh, this is interesting, I want to save it for later. And I know Marie Kondo would just love to get in my house and get her hands on all these journals. But I'm guessing you guys probably don't have the same subscriptions I do, and you're going to be looking to news sources for your information. If you're looking at a news article, you probably want to look into the first paragraph, and that's going to tell you where the data they're quoting was originally published. The first sentence of a CNN article may say something like, a new article in Pediatrics just showed whatever it is that they're going to say. A Facebook friend of mine recently shared an article, and I won't mention her source, but it was basically something like 10 things you didn't know about vaccines. I went back and answered each of those 10 concerns with actual scientific studies that disprove the point that the author was trying to make. In the end, I wound up pointing out that this article was full of spelling errors and the doctor who wrote it didn't actually have any medical degree of any type. I've actually gone back and hunted down the credentials of more than one author who's claimed to be a doctor who actually had no medical degree of any sort. Make sure you know who you're reading and whether or not anyone else in the medical community, such as a peer-reviewed journal, actually respected their work enough to publish it. Finally, I just wanted to tell you one more thing. A friend of mine texted me a picture of her son with a pirate's patch over his eye, and she told me she was concerned that he had scratched his cornea. I told her that we don't actually patch corneal abrasions anymore, and she asked me why. I was out with my family trying to enjoy a little time with our kids, so instead of going into all the details, I sent her the link to the Cochrane Review that talked about why corneal abrasions should not be patched. If you're looking for good information, the Cochrane Reviews are independent, systematic reviews of the literature, kind of like those meta-analyses where they pick a subject and then they will basically combine all the research that's available on that subject and come up with recommendations about what is valid, what is strong, and what you can actually apply to yourself or your patients. A lot of medical recommendations come from these reviews. There's a ton of valuable information in them. They are also designed to be freely available to anyone, and they're available in 14 languages. The summaries are free, but if you want the full analysis with all of the data, sometimes you're going to have to pay for those articles. But the summary often gives you all that you really need to know. So if you really want to do your research and go beyond what the news articles are presenting to you, I would recommend looking at the Cochrane Reviews and seeing if there's anything pertaining to the subject you're interested in. The last thing I want to tell you about is something that we would do in any academic medical institution called a journal club. When we did our journal clubs, we would basically review an article, decide if it was relevant to our patients or not, and whether we were going to use that knowledge to change how we practiced. If you feed rats lots and lots of sunscreen, they can show signs of endocrine disruption. Does that mean if I put sunscreen on my children, on their skin, and not feed it to them, that they will show any signs of endocrine disruption? Well, my children aren't rats, so there's a big dissimilarity there, and they're not eating sunscreen, so that's another big problem. So I don't know if that study is at all related to my children wearing sunscreen. It was statistically significant in the rats, but is it clinically significant to my children? Probably not. Finally, I just want to bring up the case I discussed in my vaccines and autism video. I brought up the case of Andrew Wakefield, who had published a study back in 1997 saying there may be a link with vaccines and autism. This was unfortunately published in The Lancet, one of the well-respected journals I mentioned before. Basically what he did was he took 12 children who had autism and asked their mothers if they remembered if they had any signs of autism before they got their MMR vaccine. Most of the mothers said no. They didn't think they had signs of autism before the MMR, but they did have signs after. Especially at that time, before there were early screening tools for autism, most autism was not picked up until the 12 to 15 month mark, which is when children are starting to get their MMR vaccines. This study was also subject to recall bias, meaning that it was dependent on the mothers to remember what had happened. Nobody had actually observed whether these children had signs of autism before or after their MMRs. Additionally, all of the other investigators later came forward and admitted that they had falsified those results of that data and that there was actually no link whatsoever. However, this got published, it got national and international attention, and it sparked a movement of fear of vaccines that has now caused a huge worldwide health problem. Since then, dozens and dozens of studies have showed no link between vaccines and autism. Some of these studies involved millions of children who were followed for years and years and developed no signs of autism at all. I have a link to a document that shows every study investigating vaccines and autism, and basically all of them showed there was no link. The Cochrane Review on this subject, which included data from over 1.5 million children, showed that there was absolutely no link between vaccines and autism. It's kind of amazing that we now have 22 years of solid scientific research on this subject, millions of children who have been studied, and yet we still have parents who want to believe a study that was done based on the memories of 12 mothers, which has since been retracted. The author was stripped of his medical license, and all of the other authors have said the results were falsified. It's hard. It's hard for us as pediatricians. We didn't become pediatricians because we're in the pockets of big pharma. We don't want to hurt your kids. We aren't making big bonuses or getting fancy vacations because we trick you into getting vaccinated. Just about everyone I know became a pediatrician because we love children and because we want to make their lives healthier and happier. For many of us, it's a calling, not a job. I'm not telling you to put blind faith in your pediatrician. I encourage all parents to do their research about anything related to their child's health. That's why I'm trying to give you these tools today so that you can do good quality research. I want you to be equipped to critically assess the information that's out there so that you're not wasting your time on bad research or things that are falsified or badly done. Look at the sources. Is it a peer-reviewed journal? Is someone out there trying to sell you some sort of expensive alternative therapy? Is it a meta-analysis or a systematic review? Or is it an anecdote? Is it a tired and worn out mother doing some kind of dramatic spoken word piece about her own personal experience? Believe me, I am sometimes a very tired and worn out mother wandering aimlessly through Target while my kids pretend like that giant red cart is a garbage truck and they're picking up everything and throwing it in as if it's trash. When I see another tired mom in the cough and cold aisle and she asks me which one of these medicines is going to work for her child, I'm still going to tell her the AAP doesn't recommend any cough or cold medicines for children under 12. Will she believe me, or will she just wait for the next tired mom to come through and tell her which one worked for her kid? This mom has a choice. She can look at the data that comes from the results of studying thousands and thousands of children that was analyzed to form a recommendation, or she can just find the closest stranger and find out what worked for them. Based on my experiences in Target, she may just be looking for the person who tells her what she wants to hear. But if you really want to do your research, I hope this video has given you a few basic tools that you can use so you can get good information and make informed decisions about your child's health. So don't forget to tell me about the craziest thing you've heard about health on the internet. I'd love to hear it. Please put it in the comments below. Let me know. Also, don't forget to hit that little red subscribe button down there so that you don't miss out on any new content. This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.